counties and the Ministry of Health. And therefore, as unions, we are calling that there is need to have a national task force on health that will bring on board the Ministry of Health that are responsible for capacity building and for policy and training. We want a task force that has county governments and the Council of Governors so that they can discuss and see ways to implement these policies that are being put in place. We want a task force that has unions that will ensure that these policies actually help service deliveries so that wananchi can actually get the care that they need. The task force, the national task force, will actually ask as element to standardize all the other task forces in the country. We are calling also that there's need to employ healthcare workers. We saw in the manifesto, there's a plan to recruit 20,000 healthcare workers. But as we have known, because we have been in this country where there's politics of the county government and politics of the Ministry of Health, there's actual need to standardize and to see that the 20,000 healthcare workers that were to be employed within the first 100 days, how are they going to be employed? How many doctors will you put in place? How many nurses? How many clinical officers? So that within the 100 days, the facilities that we believe have been constructed by the previous governments can actually offer service to the wananchi. We are calling upon the government, therefore, that we need a national task force. The other thing that we are calling upon strongly, that as we speak today, we have over 30 counties that have not paid salaries for the month of July, for the month of August, and for the month of September. Ideally, we would have not been at work in many of these counties, but we chose deliberately as unions that Kenyans need to get healthcare, Kenyans need to be served, and we are giving benefits to the newly elected leadership that they just came to the office, but they need to come up with a framework that will ensure that no worker goes month on without salaries. It is important that every governor who has come to the office, it is important that the Ministry of Health, it's important for the president to ensure that the workers in the civil service, effective in the month of October, do not work for months without salaries, because we are giving it as an olive branch that we must be having a social dialogue, a platform to discuss the issues of healthcare so that the government does not react when we issue strikes or we go on demonstration. Because unions work on a tripartite agreement. We do not beg, we do not ask for favors, but we ask to bargain to ensure that every Kenyan attends the healthcare, the high standard of healthcare as enshrined in our Constitution, Article 43. Thank you.
Thank you, Duba.
Thank you.
Naitwa kwa majina Mohamed Duba. Mimi ndio chair ya Kenya Health Professional Society, representing 15 unregulated health professionals. Siwezi kurudia yale ambapo wenzangu wamesema, but I will try to address other issues. There is a National Public Health Institute which was constituted recently in a lot of hurry. Ilifanywa kwa haraka sana, and this National Public Health Institute is a big body that oversees an important aspect of health. And this National Public Health Institute was constituted without involvement of the key stakeholders. We don't know the bad and the good of it. So we are requesting, we don't want to go litigation. We are requesting the Ministry of Health to bring the stakeholders on board, because we are the implementers of National Public Health Institute. The implementers must be involved. We don't know why it's done in secrecy. We don't know the good and the bad, because it is unconstitutional, and we don't force us to go the other way, litigation. Involve the stakeholders. The other one was framework for career development. This one was recently, the draft is in circulation. It's about career progression of the health workers. Again, there was no stakeholder involvement. In fact, it was very retrogressive, because it brings the entire health cadres to stagnate at job group P. And the same National Public Service Commission has approved health workers to go up to job group U. We don't know the rationale of doing that at this point in time. In fact, we have cadres in Ministry of Health who has gone to enhance their career at their own cost from masters to PhD level. And I don't know why this has to happen. We are supposed to be motivated. So again, there was no involvement in this. We need the key stakeholders to be involved and to be reviewed immediately. We have put up our petition and we have addressed it to the relevant parties. There's also organogram, which was also brought up in a hell of a hurry. In fact, I would say in a hell of a hurry. Very recently, in July, and then they want to implement without involving the stakeholders. This organogram is going to be cascaded to the counties. The stakeholders, the health workers were not involved. The county government is not involved. So it must be reviewed. Let's not proceed with with things that are done under the table. This is an era where things must be put open on the desk. So this one should not proceed because we are not party to it and will contest. I think the other one is about promotion. I think promotion is a big problem. It's cross-cutting at the national government and as well at the county government. Officers have been stagnating. Health workers have been stagnating in one job group for even over 20 years. This is historical injustice. It must be addressed. Because the very rationale of devolving the public health service, the county public health service to respective counties is to enhance promotion on timely basis. So this has to be done. I think that is all from me. Thank you.
Thank you. Briefly, we have Oliver, and then we have Katibu Gibore to summarize in Swahili.
Good afternoon. My name is Baras Oliver. I'm the National Chair for Kenya Union of Medical Laboratory Officer. I think my colleagues has quite touched a lot of issues, but I just want to point one thing that our members has been complaining about on the issue of the failure to non-remittance of the third parties from the county government. There is a national outcry from healthcare workers, especially those who took loans from the banks, SACCOs, that are being auctioned because the county government has failed to remit their deduction. We are calling upon the county government who have failed to do this to act promptly, because this has been a big burden to our health workers. Because at the end of the day, if a bank has come to auction you, you cannot even be able to pay the school fees of your children. It's a big issue. And then another issue that I just want to touch on is a health information system. The laboratorians, especially in the laboratory information system, we call upon the government in place to work on a robust laboratory information system, because today we face quite a lot of challenges. You find a patient has been diagnosed, maybe done laboratory test, let us say in Turkana, he comes to Nairobi, he is forced to repeat the same test because there's no a health laboratory information system where the doctor can review what was done the other side and this side. So the patients are forced to pay double amount. So we are asking the government to look in this issue from a very critical perspective, and also to involve the stakeholders and development this. And lastly, on the issue that my colleague Tuba has touched, on the issue the things being done in a hurry without stakeholders' participation. We are calling the government to involve the stakeholders in these issues who understands what there needs to be done. Especially on the public institute that been cassetted, we were not involved, and laboratorians are majorly involved in this, and we are calling the government to not to be in a hurry, but to call stakeholders on board to discuss this issue before they implement. Thank you so much.
Thank you. Thank you for at least for coming here, and I want to highlight on a few. As we have already stated that we congratulate the new government. We want to really appreciate that health has been the agenda during this election. And indeed, with the specific issues that have been highlighted in the Kenya Kwanza Manifesto, which is now the government in place, we really appreciate. But one of our main call here today is that we need to be enabled to support the government, because there have been misunderstanding where people think that the unions are anti-government. That is not the agenda. We want a task force in place which can involve all of us. We get to participate and contribute on how health need to move forward, especially on the agenda of ensuring that the primary health care concept is working, which is an enabler to UHC, must be realized by the practitioners participating. We do not want things that are done on the table and then the implementers do not understand what you do there, and then we fail, like the way we failed during the launch of the UHC and a number of other programs that have not been able to work. As the drought continues to ravage this country, the health indicators continue to suffer because priority to seek health services is an issue. We need to ensure that the country is keeping its focus clear and ensure that the agenda for health continue to thrive. We have seen the proposal by the Kenya Kwanza to ensure that they establish a health service commission that does not really disrupt the county government. And that is the one thing that we really feel that can address the issues of the health sector, especially the human resource aspect, where we have been having delayed promotion and a structured way of employment, these different terms of employment, and including procedural and irregular firing of health staff. We know that this has been a big issue in Laikipia, where at least the new administration has corrected that, but we still continue having the same problem in Kirinyaga. People who do not even actually respect court orders, including other institutions. We want to appreciate that the new government has promised to ensure that different constitutional institutions have been respected and the quotas of the court orders are well implemented. We want to call upon this administration to ensure that no county should go scot-free without actually implementing the court order or any other constitutional institution, including the Public Service Commission, orders against the counties. That must be adhered to. And as you have heard my colleague talking about a number of issues that the Minister of Health continue to do without stakeholders' participation, is the same issue that a number of constitutional bodies continue to do, including the SRC. We are saying we will not take them while lying. We will fight to ensure that our members' voice is well heard. Kama vile ambavyo tumesema hapa leo, tumetoa shukrani zetu kwa Wakenya na pia haswa tumeweza kuwapongeza wale ambao wameteuliwa kama viongozi, kuanzia kwa Rais William Samoei Ruto pamoja na msaidizi wake Rigathi Gachagua, na pia wagavana wote na wale ambaye ni wabunge wa makaunti na hata wale wa National Assembly. Tumesema congratulations. Lakini pia tukikuja hapo, sisi kama wawakilishi wa wahudumu wa afya tunataka kuhusishwa katika maamuzi vile ambavyo tunataka kuendesha sekta ya afya ili kuimarisha huduma kwa Mkenya yoyote yule. Tumesema kwamba tuweze kutengeneza kamati ambayo itahusisha watu wote ili tujadiliane ni jinsi gani tutaweza kumakinisha ama kuendelesha huduma hii ya afya kwa watu wote. Tumetaja kwamba kumekuwepo na udhaifu tangia ugatuzi ulipokuja. Tukataja kwamba hakuna watu hawapandishwi nyanja kwa sababu fedha hazipo za kutosha, na pia tumeona watu wakifutwa kazi pasipo kufuata sheria. Tumeona kesi mingi kotini kwa sababu ya mapigano ya wahudumu wa afya na waajiri. na sisi tunasema kwamba hatutaki kuona haya maneno yakiendelea katika serikali mpya. Tunataka kuona serikali mpya ikitii sheria, ikifuata sheria na ikifuata kanuni zilizopo, ili kusudi tuweze kuendelesha afya, kwa sababu kunapokuwa na mgomo, wananchi na wagonjwa na hasa pia Kenya kwa jumla inakuwa imepoteza. Hakuna yule ambaye anaweza sema, hata kama sisi wahudumu wa afya tunapokuwa tumeenda kwenye mgomo, hatusemi kwamba tunafaidi. Kwa maneno hayo ndiyo tunayokemea, na tukiita kwamba kwa ule mwito ambaye serikali imeshautoa kutii na kufuata kanuni zilizopo na sheria, lazima sisi pia kama wahudumu wa afya tutafuata, na pia tuweze kupewa nafasi ya kuweza kushiriki kusaidia serikali kukamilisha yale ambaye wameweza kuahidi wananchi. La mwisho, tumesema kwamba tumeona katika ile manifesto ama ruwaza ya Kenya Kwanza, wamesema kwamba wanataka kulete mchakato ama kuanzisha ile tume ya kusimamia wahudumu wa afya. Hiyo tunaitikia na tunasema tuko tayari kushiriki, na tunasema kwamba hii tume ikiwepo haiwezi kuharibu ama kuja kupunguza kazi iliyopo katika ugatuzi. Inakuja tu kwa minajili ya kuhakikisha kwamba tumeweza kurali, national government imetoa fedha za kutosha katika sekta yetu ya afya, na pia tuweze kusukuma wale wamepewa wajifa ama wamepewa nafasi za kufanya uamuzi katika sekta yetu ya afya, under leadership and governance, wamefanya majukumu yao. Na lingine, hiyo tume ikija itahakikisha kwamba wahudumu wa afya wanapewa mishahara yao kwa muda, kwa wakati mmoja, wanapandishwa vyeo vyao kwa muda ambao umefaa, na pia wanaruhusiwa kwenda kuongeza masomo yao, kwa sababu hiyo inakubalika kikatiba. Na haya yakiweza kutatuliwa, basi tutakuwa tumetatua donda sugu ambalo tumekuwepo nalo, migomo kila mara katika sekta yetu ya afya. Asanteni sana.
I just want to summarize and say that what action will we take if all these things that we're talking about is not implemented? And on particular one, we are concerned on the issue of salaries for the workers in the counties that have not been paid in the months that I've said, July, August, and September, and also the statutory reductions that have not been paid, including loans. We know that there are new governors and new leaders in office, and we have congratulated them, and we have given them time. But as healthcare unions, all the healthcare unions, we have deliberated and discussed and find that it's a right for everybody to be paid for the days worked. It's a right for every fund that are deducted to be remitted. And therefore, in the next 40 days, and by that I mean by 5th of November, if we have any county that shall have not paid the workers, the healthcare workers, their salaries, and have not remitted statutory reduction, then we will not, at that particular time, sympathize with the governors. But we will ask those workers not to be at work and to wait until all those statutory reductions are done. And this is a bargain and it's a demand for all the healthcare workers. Therefore, all the governors need to make sure that this time period that they came to the office, they should fix the healthcare. They should ensure that everybody works and is getting paid on time. Thank you.
Yeah, I've been asked by a few to talk about Ebola preparedness. As you know, that I led a contingent of Kenyans in 2015 to Sierra Leone to help them with the fight with Ebola. So, the things that we are talking about today, actually that is what constitutes preparedness for any disease. When we are talking, and I think the good thing is that we are just coming from COVID-19. But I want to assure Kenyans that Ebola does not compare in any way to COVID-19. It is more fatal, it kills more. In fact, I think as per the statistics, it has a fatality rate of well above 50%. But now, What contributes to that fatality rate? Because probably I can give a short history of how Sierra Leone got to where they got to. It is because of the issues that we are discussing here today. The government, when Ebola came, one, they never involved the health workers in preparations. The second thing is that they really had a dire shortage of health workers. And because of that, they were not even able to take steps in time to be able to train them, to sensitize them so that they could have confidence in the protective gears they were giving them. And the moment some of them actually fell ill and died out of Ebola, health workers took off from the facilities. So people could get sick, but you go to facilities and there was nobody to see you. Actually, more people died out of other diseases than Ebola. When you look at our context, and I think I have said severally, that the biggest problem with our country, Kenya, is that we do not learn. When we came from West Africa, we actually did a very good report and asked the ministry to be able to establish that emergency department to be able to respond. That never happened until we had COVID-19. Now, we thought that we had learned with COVID-19 in terms of the shortage, in terms of involvement of the health workers who offer service delivery. But we're actually seeing opposite of that. We were expecting that as one of the lessons from COVID-19, that the following years we would have seen more budgetary allocations so that we can capacity build the health sector in a wholesome way. We were expecting to see in every year that we're having annual recruitment so that we can be able to have the adequate staffing to be able to cater for such diseases when they occur, but most importantly, to have an environment where we can even be able to prevent them so that we don't become firefighters. So the status where we are in today as a country is that we are still vulnerable. We still lack adequate staffing. We are still doing things in opaque manner where people will sit somewhere and discuss how they are going to address Ebola without involving stakeholders, and then they expect them to be able to come out and deliver. We are very slow. You can imagine we have not even rolled out sensitization and training for health workers in regards to Ebola. I can give the government credit that they have been able to beef up the screening in the points of entry. But we need to be more vigilant and we need to prepare health workers so that they can be able to respond. Because now we are having a conversation. But if we were to have that disease in this country, things will be very different. I doubt even we will be able to even come here and have this conversation. So we really need to take health seriously and prioritize as a country and ensure that your health workers even have the right state of mind. The things that we are discussing today, the erratic and ineffective management of human resources, they have really impacted on health workers. Mental health is an issue. We have seen 3 health workers die from suicide. If you remember the case of KNH resident, the nurse in Madare, and the other one I'm forgetting from where. And many others have actually fallen into substance abuse simply because somebody cannot be able to get an inter-county transfer to join their spouse elsewhere. And these are the things that we are saying. Sort the health system in totality, and then you'll be able to prepare your country to respond to emerging diseases like we are having with Ebola. I think we can take questions, and as you ask, also direct to the person you'd like to answer. Yes, Zainab. Yes. Yes. Thank you. I think I can take mine and then Davji can come as even they continue taking the other questions. And what do we expect to see going forward? We need to prepare our health workers. We need to prepare our health system. How do we do this? We have a pool of people who have experience and courage to be able to face this, the team that had gone to West Africa. But even in addition to that, we are now even having a bigger pool who have worked with COVID. The first thing that we should be able to do is roll out sensitization and training for health workers to prepare them. The second thing is that we should have adequate protective gear. And we should not have the cat and mouse games we were having with COVID-19, where you are told that you have enough, but people are dying because they are being infected due to lack of the same. The third thing is that we should be able to employ more health staff so that they can be able to handle in case we are going to fall into that. But not even to handle when Ebola comes in. For you to be able to pick it early enough, you need a health worker who is motivated, who is not fatigued, so that they can be able to even suspect and be able to send these people for the laboratory tests. But if we are going to continue with the shortage that we are having, and the moment you are meeting that health worker, they are fatigued, they're having mental cloudness, they cannot even give you a proper diagnosis, then you are actually not going to be able to prevent it or to pick it at the earliest. And the other thing is that in the preparedness that the ministry is doing, it should also involve the representative of health workers so that we can be able to know what is happening, and health workers can also know that they have a way of giving their feedback so that their issues can be addressed. I hope I have addressed that part of the question. I think Davji can take the other one.
Just to close by, in a pandemic preparedness situation, we need a resilient healthcare system. We need a system where both the wananchi, that the public understand what condition is or what outbreak is coming or what pandemic is coming. So as we really appreciate what the ministry and what the government has done over the COVID-19, we feel like there's need that the stakeholders engagement, that when an outbreak has been announced in Uganda, it should not be a matter only of the Ministry of Health, but it should be a matter that is discussed both with the Council of Governors, with the counties, and with the healthcare workers, because preparedness needs the entire population to understand the disease, to understand the pattern, so that we all can take mechanisms to prevent it. And secondly, we are saying strongly that all these healthcare workers, they need to be enumerated. They need to be paid their salaries. It is impossible and it's difficult to expect healthcare workers, doctors and nurses, and able to be at work when they can't even pay their bills. So that is also part of preparedness. Release the funds that are meant for healthcare workers in the counties. Release the funds that are meant to employ more healthcare workers so that we do not see a reactionary process that we saw in 2020, whereby we plan to have healthcare workers once we have a situation or once we have a pandemic. We had seen a scenario and mechanism that was put in place to combat COVID. Those strategies, they need to be implemented. We do not have to wait for another pandemic to institute them and to make them actionable. So that's why we as unions are saying that there is need, a deliberate need by the Ministry of Health, a deliberate need by the national government, a deliberate need by the county government and the Council of Governors to ensure that there is preparedness for any pandemic, there's preparedness for any outbreaks, and that any Kenyan, to any public hospital that they go, they can get services. And this is only possible if we beef up our staffing. We employ all the about 4,000 employed doctors in this country. We employ the clinical officers. We employ the nurses, so that the 20,000 mark that was promised actually will be a great way to combat this Ebola. Thank you. Thank you so much. And thank you for your time.
Thank you.